All right, so this massage here that I'm showing you guys, I'm working the erectors area, slowly working the area of the these muscles, and just very gentle, but enough pressure to work on the muscles. Working slowly all the way to the quadratus lumborum. And here we're working this supraspinatus. Supraspinatus muscle is part of our rotator cuff muscle. It's responsible for lifting our shoulder. So right here, I am just trying to follow the muscle fibers all the way to our QL, and then so when I work on the muscles before I dig in, I try to palpate the muscles where is the congested areas, and then apply pressure progressively. So here I'm working all the way to the QL, and then go back up, smoothing the area for relaxation effect to the client. And a little effleurage to relax the muscle area, especially after giving a deep pressure. That's always relaxing. Here I'm working more on the QL area, spreading muscle fibers there, giving a little bit of stretch. The rhomboids area there between your shoulder blades, and then back to the QL. Low back work must not be forgotten, because this always, especially clients that often sit down because of their job, so they always have these issues in this area. So lengthening the quadratus lumborum always help. That's a very important. This is like felt really great if you are on the table and just work on the QL right here, and it feels like heaven. So just following the muscle fibers here, checking muscles elasticity and finding the congested areas before I can, where areas that I need to apply my pressure in, maybe trigger points here and there to release the tension. Working the traps here. Now I'm working the QL here again. I love the QL work, especially when I give a massage. I like that area to be work on, but sometimes, I get kind of like disappointed because don't have get enough attention. So when I work with my client, I make sure that some of this, especially if they ask full body massage, and then try to get the most parts, especially under focus areas, of course. Back is a very broad area. It takes a lot of time to work in this area, a lot of muscles involved in this area, especially in our shoulder, our neck, shoulder. Takes a lot of time to work in this area. Here working lamina groove. So There's my phone number here in my website if you're interested to book a session. We're serving around Austin, Texas. So yeah, Lamina Grove will work all the way to the sacrum area. Now we're gonna work on our shoulder here. It's always nice to have the really good shoulder work. Shoulder mobilization, shoulder stretch. It always feels amazing to get rid of all the congestion. Mobilizing the shoulder blades to loosen joints, constrictions. That helps our range of motion, our shoulder. Trying to work on this levator attachment here. You know, levator, that's the muscles that always get affected when you sleep wrong to your side. So that's the one that gives you stiff neck, levator, scapula. It's a big fat muscles, and it goes insert through your on top of your angle of your shoulder blades and goes to your neck and laterally, and then it twists it. So there's actually two of them, and once they get messed up, it takes a little bit, like probably about 10 days to get loosened up, or a week or so, depending on what type of work you did to it. So this is what I'm trying to do here. Now if you watch again, we're down to the area. Now we'll go to our teres area here. Part of the rotator cuff again. Shoulder. We do our hands work here. Hands massage is always amazing, especially those people that work on the computer a lot, you know. This feels like heaven. Even me, as a massage therapist, I love hands massage. Justling on the shoulder is always nice to add. Mobilizing the shoulder joints is a great technique to loosen the tension and get rid of those constrictions and improve the range of motion on the shoulder. Justling again. You see that it helps work all those muscles, not just one muscle, but a group of muscles, and it also feels good. Yeah, right there, move the shoulder blades. That's always amazing. And also improve the circulation, the blood flow. You know, wake up those muscles. I'm moving the shoulder blade here using the weight of my client. So, you know, our shoulder blades, our scapula, sometimes it gets stuck because there's so many muscles connected to it, and we use it every day. So that's our wings, you know. So mobilizing it, it helps give mobility to it, and that's definitely improve the range of motion of your shoulder. And so the anterior deltoid here, when it gets tight, often limit your external rotation of your arms. So it's important to not forget that area. And of course, our wrist extensors. This area right here. People that works in the cars, mechanics, what else? Plumbers and works in the computers, cook, guitarist, pianist, all those people, they love hands work. These are the people that can use really good arms and hands work. So working on the neck, gentle but consistent pressure. I don't really have a lot of pressure on my arms there going to the interior neck, okay? I was just gliding. But here I'm working on the ACM. Not pressing too much on the interior there, okay? Just outside the ACM. Careful the work here, pressure, especially if you reach to the interior area. Because they have a lot of nerve there. I mean, we don't want to damage. But at the same time, we don't want to just avoid the anterior neck. Because anterior neck is responsible of us having pain from our posterior neck. Because they're pulling our posterior neck. So we need to loosen, we need to work that anterior neck, but of course carefully, not to be pressing anything there that do not need to. A little stretch here and there is great. This area right here just feels great. Traps all the way to the sub-occiput. And a little stretch in the pecs. Always feels wonderful. And goes to the other side again. Let's not forget the other side. Other side also needs some loving. So most of the time when I work the upper back, it's always nice to use the weight of the client to give them pressure. So because I don't need to work so hard. They have their weight, so I can just use that against them. Pectoralis work is always nice. Now it goes to, this is just the other side. We've done the hands work earlier in the arms. This is just the other side. I always love to, it's always nice to work on that. The dorsal of your hands. It's always, it feels good. And of course, you know, the arm and by the elbow. It's important by the elbow because all these muscles from our wrist extensors and our wrist flexors, they all connect to our elbow. So elbow must not be forgotten for that. That's a lot of muscles that connect there. Every joints should be work on because that's where our tendons connect those muscles. So yeah, jostle again, always nice. A little stretch is a nice bonus. Here we're just jostling the legs, jostling, mobilizing to introduce my touch to the area before I actually undrape the area. You know, just telling the muscles here, hey, I'm here, I'm ready to work on you. Okay, so that's what I'm doing, just introducing, not to, so I don't like rush the muscles. Just introducing myself, and you know, it's always good to have introduction. And start with the effleurage, warming up the muscles, introducing the touch. Until the muscles is ready, gets warm up and ready for treatment. I like this work right here. Moving it and jostling it while you're doing the work on your hamstring. And you don't need to press too hard because you're using that movement, muscles movement adds a little bit of pressure. And then you do not need to add a lot of pressure. Feet work always feels great. Leg work requires attention, of course, making sure not to press bony parts for clients' comfort's sake. Especially the knees areas, the ankles, and we don't want to hurt anyone here. So here the calves always get tight. If your calf is tight, it's really tight, that affects to your feet. And then you start feeling those pain in your feet, the arch of your feet and the heel. So when that happens, you start stretching the calves. Then when the hamstring's tight, start pulling the hips in. Low back tight. Here we're working the IT band. This area here can get so tender by other people, so we need to work here with caution. Ask the clients how deep or pressure that they can tolerate. It's always communication is the key for the treatment to be successful. I like my client to talk to me like more pressure here, less pressure, stuff like that. I never get offended because the treatment is for them. This is not for me, it's for them. I'm just here to treat them, and if they don't talk to me, and I will not know. So that's why I always encourage my clients to talk to me during the session. Here we are mobilizing the joints of the hips. Now work the feet again. Feet work is always nice, especially the area there, the ankle, the dorsal of the feet. Yes, we always use our feet. Our feet are the ones that holding all this weight we have, so let's not forget that. A lot. Our feet do a lot of work for us. Need to have some loving. Arch is always good. Medial thigh is always good. Constricted medial legs muscles, yes, can limit our hip lateral rotation. And quads, lateral is always good as well. Our quad muscle sometimes can handle a lot of pressure. We tend to put a lot of pressure here because this is a big muscles. There's 4 of them. And can handle a lot of pressure, but sometimes, especially those athletes, they tend to get really tight here because they got really tight quads, very muscular people. But we also need to put more pressure there to break that adhesion. But of course, too, we also need to communicate with the client if they are comfortable with the pressure. So doctors work here cautiously. We don't want to hit any nerve, okay, and harm our clients. So be cautious, especially in the medial area. Slow work, deep enough, and lighten the pressure should go down. and go back again, gentle but consistent pressure. What I don't like is putting pressure and deep pressure and then drag it too fast. And when the therapist start dragging it too fast, it's not very comfortable. So I realized, well, because that's what I experience sometimes, and maybe that's just me, but I like more kind of like slow, but with consistent pressure, light, medium to deep, and then finish up with just kind of like a little effleurage to introduce a relaxing effect. And what's really good is if you start from attachment to attachment, start from attachment and end with attachment. That's very nice work. Heel the foot is always nice. Calves works. Here I'm going to jostle this leg to mobilize the hips and do a little stretch there. That's always nice. All right, and that's it. Thank you for watching.